in its entirety earlier this week. So we're joined now by Republican Congressman Roger Marshall, who is also a physician. So, Congressman, it is great to have your expertise on that as well. Good morning.
Good morning, Allison. How are you doing today?
I'm doing well. So I know that you met with the president this month about health care. So share with us what the plan is.
Well, I think, first of all, the president emphasized that we have to embrace pre-existing conditions, that he would not sign any type of health care that doesn't take care of pre-existing conditions. And not only that, he talked about taking care of the 28 million people that still don't have health care coverage. So very much the president's in tune to this. We talked about the real problem, which is the cost of health care, and we talked about ways we can start driving that cost of health care down.
Okay, so how do you cover people with pre-existing conditions and the 28 million who you say still need insurance? What's the plan for monetarily making that work?
Yeah, I think, first of all, looking at the big picture, I think America has a very clear choice that both Democrats and Republicans want to repeal Obamacare. The question is, what do we place in substitution for it? The Democrats want Medicare for all, which would be the ruin of Medicare as we know it. But our solution will put patients and families in charge of their health care. So anything that we can do to drive those decisions locally to patients and family members will start driving the cost of health care down and will allow more people more access to health care.
Well, not all Democrats want Medicare for all, and not all Democrats want to repeal Obamacare. What I hear most Democrats say is they want to improve upon it. Why throw out the entire Affordable Care Act before there's a plan where it will leave people not covered? It will leave people with pre-existing conditions scrambling for for insurance.
You know, I'm sorry, but I think that's a false narrative. We do have plans. We have a year, probably this court case will take a year to go through. We have several plans right now that would take care of that situation.
And do those have names? I mean, I'm just curious, because do we know those plans? Or is this the Graham Cassidy plan?
Absolutely. We have several names to choose from. So Dr. Cassidy and Senator Graham's plan would be one of them. Bruce Westerman introduced a wonderful piece of legislation the past couple of months as well. The Republican Study Committee is working on legislation. They had some legislation from 2 years ago. We've been working very hard with the president and his staff to improve it. So absolutely. But if I could just say one thing, you say that some Democrats don't want Medicare for all, but this election in 2020 is going to be all about just that. President Trump will be reelected because he wants to give patients and families choices, but every major presidential candidate on the Democrat side wants Medicare for all. So I do think America has very much a binary choice over this issue.
Yeah, I mean, I guess that the reason that it's hard to understand where the Republicans are with this is because you tried before when you controlled both houses of Congress, and it didn't work. So whatever the Republican plan was, be it Graham Cassidy or anything, it didn't work. And now you don't control the House. And it doesn't sound like Democrats are willing to sign on to things that would just give states block grants to do whatever they wanted with the money and not guarantee it for people with pre-existing conditions.
You know, I think that's the beauty of President Trump's plan is as we go forward, he's basically putting a gun at our head and saying, look, you have to fix this. We cannot keep going in the direction we've been going. The Democrats are going to have to work with Republicans. I do think there's that opportunity. I've sat down with most every Democrat in the House that has health care experience and talking about solutions. So those solutions, we're actually very, very close to solutions, but sometimes it just takes an impetus to push us over the ledge and say, let's do something together here. Let's fix this problem. But if that doesn't happen in 2020, this presidential election is going to all be about Medicare for all versus choices for families and patients.
I just want to move on for 1 second to the Mueller report, because you've been tweeting a lot about it. Of course, you haven't seen the Mueller report, nor have I, nor has anyone yet. But you seem to feel quite confident that it won't reveal anything. What if there is something embarrassing in however many pages once it ultimately comes out?
Well, I think that's kind of a crazy narrative as well. Look, every Democrat, all the major news stations said Mueller is the man. He's going to give a great report. He had unlimited resources. He spent $50,000 a day. I think that if there was anything there, he would have showed it. It was the most expensive nothing burger in American history.
I mean, it was as I understand it, it was something like $25 million. But obviously the Starr report cost more. I mean, there are American history examples of things that cost more, but more importantly, you know that there are all sorts of property seizures and fines where they might recoup much of that money. So I know that you have on Twitter talked a lot about the expense of this, but it's possible that the government's going to get back a lot of that expense.
Well, we can only hope so, but people back home want to know, how can we spend $50,000 a day? That's incredible that we could spend that much money, and we really know nothing more today than we knew when this whole investigation, this witch hunt started. So it's just very frustrating that we have frozen America over a false narrative for 2 years when we could have solved health care, when we could have built a wall, when we could have fixed immigration. There's so many great things we could have done, but this single issue has taken all the oxygen out of the room in Washington, D.C.
Hold on a second. You think that because of the Mueller report, that's why the wall hasn't been built? That's why health care hasn't been solved?
I think it's a great deal of it, because this single issue takes up all the oxygen in D.C. I've never been to a place that couldn't do 2 or 3 things at one time. But this issue has kept the Democrats on this witch hunt, and we've been sitting here without any cooperation working back with us. So absolutely, this took all the air out of the room.
What about Infrastructure Week? Could you have accomplished that?
I think it would have been very possible. I think all along that President Trump has wanted a strong infrastructure plan. It's on his to-do list. It's on my to-do list. And again, I've worked very hard across the aisle, but we can't start talking about a major infrastructure plan in committee until we get this Mueller investigation behind us. Can we please move on? I'd love to fix infrastructure as well.
As soon as we get to see the Mueller report, I think it will be easier to move on. But Congressman Roger Marshall, thank you very much for coming on with your perspective and medical expertise.
Thanks so much. Let's solve health care.